Big breath, get tight. 1, 2, then go. Does that feel different?
No pain.
Chucky had been experiencing low back pain after filming a YouTube competition where he performed 40 reps at 225 as quickly as possible, since he hadn't been able to pick up over 275 pounds without pain. 45 minutes later, he was able to pull 365 pounds.
That's the most you've deadlifted in how long?
Probably about a year and a half.
A year and a half?
Yep.
And pain-free.
Yeah. Yep.
There we go.
Today I'm going to walk you through parts of his evaluation and treatment that made some of the biggest impacts today. Now remember, most injuries in the gym are due to technique problems or inappropriate loads when lifting. For his low back, I wanted to try and uncover specific motions, postures, and loads that contributed to and triggered his pain. When assessing his single leg squat, you can see he could do a full pistol with ease on his right, but struggled with his left, noting it recreated pain in his lower back when in left leg stance. He had no pain with a static load test, lifting a 20-pound kettlebell in front of his body, or with a dynamic load heel drop test. He also reported no pain when lying on his stomach and lifting one leg at a time, which is a test for extension with rotation movement of the spine. When performing the seated compression test I learned from Dr. Stuart McGill, he had no pain with a neutral spine, no pain with an extended spine, but instantly reported back pain when pulling up with a flexed spine. Listen to this next part.
Let's play with your head position. Let's look down. Now pull up. Better, worse?
Worse.
Worse?
Yep.
Look up. Better? Okay, so looking down with a flexed spine brings out your pain more.
Yeah.
Looking up, same flexed spine, changes your pain.
Yep.
This is a very important thing to understand because that will modify your head position during your deadlift. You're dealing also with a neural component to your pain.
Okay.
The change in your spinal cord positioning by just mimicking or changing your head position can modify your pain.
Okay.
It's a very important finding.
Okay.
So at this time in the evaluation, tests are showing that he had a trigger for a flexed posture, which would be labeled as a flexion intolerance. Now I also needed to check his hips, as many with back issues also have problems elsewhere in the body.
Okay, pick your hips up, hold for 10 seconds. What muscles are working hard on this side to keep your hips up? Quads, hamstring, butt, or back?
Lower back.
Lower back is feeling it when you do a single leg bridge on this side.
Yep.
Okay, do the same thing on your other side. What about on this side?
Just feels like my right lumbar rather than both this time.
So what that's showing is that in the motion of hip extension, which is what? Raising from a squat, raising from a deadlift,
Yep.
your go-to right now is to really use your back. We want to use those back muscles isometrically, but they're not prime movers. They're prime isometric holders of your spine.
So far we can see our treatment checklist develop. I wanted to work on core stability next, so we started with the McGill Big 3, a combination of the bird dog, side plank, and modified curl up, designed to instill stability like guy wires to a radio tower.
Stiffen your spine. So again, breathe out to the side. Now don't round your back. Okay? Just from right here, breathe into my thumbs. Good. So what happened before, your bracing mechanism right now is to go up. Exactly the same thing that you do when you deadlift. Is that when you brace, you pull into a little bit of flexion. I want you to brace in that neutral range. I don't want you to move as you brace. Good. Now, this arm and this leg will extend. Did you see what happened with your back? Your back just went like this. Just arched. Okay, so come back.
Good thing or bad thing?
Bad thing for this, because my goal is to teach you how to stiffen your spine and move about your arms and legs. Have your foot about 2 inches off the floor the whole time. Sweep it out. So stiffen first. There you go. Now slowly go out. Good. There you go. Toes about a couple inches off the ground. Okay, a little bit lower, a little bit lower. There you go. Make a fist. Hold it here for 10 seconds. Make as much tension as you can from that fist all the way down to the leg. That back didn't move. This is the position I want you in.
Neutral.
This is a neutral range, yes. And then you're going to slowly sweep underneath yourself. Touch your knee to your fist, but don't let this move. Don't let this move. Tap. Now back out. Good. There you go. I don't want you to fear back movement, but I want you to understand the context.
Yeah.
Does that make sense?
When to put it into flexion and when not to.
Exactly. You should be able to flex your back if you're doing parkour movements. You won't be a very good parkour athlete if you can't bend your spine. But I don't want you to bend your spine when you're trying to deadlift 400 to 500 pounds from the ground.
We then did 20 bridges with the cue to drive down through the toes and hold the top for 10 seconds to prime his glutes, to be the major driver of hip extension. After, we worked on single leg coordination and stability with the touchdown squat off an 8-inch box. Eventually, we got back to the barbell.
What we're going to focus on is creating tremendous tension in your lower body before you start your pull. Okay, because right now what we found with the double leg or the single leg bridge test was that when you initiate hip extension, you like to go to your back.
Yep.
So what we're going to do is teach you how to get a little bit more leg drive in the deadlift.
Okay.
So you're going to approach the bar. Okay, I want you to root yourself to the ground. So squeeze your feet to the ground.
Okay.
Open those hips up. Get down to the bar. Now when you get down there, you're going to wiggle yourself into that bottom position. And then from right here, what you're going to do, look up. Okay? And then you're going to create tremendous tension from your fist all the way through your full body. You're going to be driving hard into the ground to where you're going to feel your glutes quiver because they're working so hard. You're going to initiate by pulling a little bit of slack on the bar to where you'll feel the barbell hit the top side of the weights, and you're going to hold that for 5 seconds, and then relax and stand back up. You're not actually going to finish the pull yet. You will feel your glutes tremble. You will not feel your back at all. The bar may even slightly lift off the ground, but we're not going to initiate the pull.
Okay.
Yeah? Try that. So root your feet to the ground, open those hips up a little bit. Slowly pull yourself down to the bar, and you're wiggling into a very stiff position. Okay, look up. Good. Do you feel your glutes?
Yes.
Good. It's not that a neutral spine is fully protective compared to a slight curvature.
Yeah.
But it's that we don't want to move the lumbar spine. We don't want to move the low back. And right now, you're just a few things. We're looking down, so we're getting a little bit more neural tension. But as you got heavier, you moved your low back. And I think a lot of that may have had to do, at least right now, with that dynamic start, that it's just not getting as optimal and creating stiffness at the start as you can be.
Okay.
Make sense?
Yeah.
So try a full pull now. Let's see what it looks like. And create that stiffness for 2 seconds before pulling. Okay? So set yourself down, head. Good. Big breath. Get tight. 1, 2. Then go.
Yeah.
Good.
Does that work for you?
Does that feel different?
No pain.
No pain.
I then allowed him to test his capacity a little that day with those cues and go up to 365 pounds.
That's the most you've deadlifted in how long?
Probably about a year and a half.
A year and a half?
She has
And pain-free.
Yeah.
Yep.
There we go.
What's going on, everyone? Just giving a quick little update from my visit with Dr. Aaron. It's been about a month now, and all I could say is I'm probably 85% to 90% pain-free, considering I came from a point where I was at about a 40 to 50% in terms of being fully recovered. It's changed everything. My breath that I take in before I go and I do my movements, the way I get tight, the way I grab the ground with my feet, just a whole bunch of things that he's implemented during my my visit with him has really changed the way that I lift, literally pain-free. So I feel no pain at the bottom of my lifts. I feel stronger. I'm about to do 410 for 3 sets of 5 for my next squat session, and it wouldn't be without the help of Dr. Aaron. So greatly appreciate it, man, and I really wouldn't be where I am right now without your help.